Good day, ma'am. I'm Miss Nareda Balay. I'm going to perform the head to toe assessment. First, perform hand hygiene. Assess the client's vital signs, the temperature, the pulse, respiration, blood pressure. Assessing the client's temperature. Assessing the client's respiration. Assessing the skin. As you perform each part of the head to toe assessment, assess the skin for color variations, textures, temperatures, turgor, edema, and lesion. You assess the skin, teach the client how to examine their own skin to note any warning signs of skin cancer. Next, the head and face. Inspect the palpate the head for size, shape, and configuration. Observe the face for symmetry, facial features, expressions, and skin condition. Palpate the temporal arteries for elasticity and tenderness. As the client opens and closes the mouth, palpate the temporal mandibular joint for tenderness, swelling, and crepitation. So, determine the function of the eyes. So, testing papillary reaction to light. So, test visual fields. Assess corneal light reflex. Perform cover-uncover test if corneal light reflex test is abnormal. Inspect the external eye, position and alignment of the eyeball in eye socket, bulbar conjunctiva, and sclera, palpebral conjunctiva, area over lacrimal ducts, corneal lens, iris and pupil. Taste papillary reaction to light. Taste accommodation of the pupils. Assess corneal reflex. checking airflow through the nostrils. Palpating the tongue for lesions. Inspect the lips for consistency, color, and lesions. Inspect the teeth for number and condition. Check the gums and vocal mucosa for color. Palpating the lymph nodes. Inspect the neck for the lesions, mass, swelling, and symmetry. Test range of motion room. Palpate the periauricular, postericular, occipital, tonsillar, submandibular, submental. And then, palpating the thyroid gland. Scalded and large thyroid for broods. Palpate the thyroid gland for size, regularity, and masses. Arms, hands, and fingers. Inspect the upper extremities for overall skin coloration, texture, moisture, masses, and lesions. Test the function of CN10 spinal by shoulder shrug and turning head against resistance. Palpate the shoulders and arms for tenderness, swelling, and temperature. Palpating the shoulders and arms. Testing the bicep, tricep, and brachioradialis reflex. So, percussing the posterior intercostal space. So, test for 2-point discrimination of the client's back. Ask the client to lean forward and exhale. Use the butt of the stethoscope to listen over the apex and external border of the heart. Is auscultating the posterior chest. Auscultating the anterior chest. So, inspect the anterior posterior diameter of the chest, slope of ribs, and color of the chest. Palpate for tenderness, sensation, masses, lesions, primitus, and anterior chest expansion. Percuss for tune at a place above the clavicles, then at the intercostal space, comparing bilaterally. Auscultate for anterior breath sounds, adventitious sounds, and voice sounds. So for the abdomen, inspect for overall skin color, vascularity, lesions, and rashes. So auscultate for bowel sounds, vascular sounds, and broadcast for turnover for quadrants, liver location, site and span, spleen location and size. Deeply palpate for quadrants for masses. So inspecting the abdomen, and then auscultating the abdomen and palpating the abdomen. Legs, feet and toes. Inspect the lower extremities for overall skin coloration, texture, moisture, muscles, lesions, and varicosities. Observe the muscles of the legs and feet. Note hair distribution. So palpate the joints of the hips and rostrum. Palpate the femoral pulse. Palpate for edema, skin temperature, muscles, size and tone of the legs and feet. Palpate the knees, including popliteal pulse. Palpate the ankles. Assess dorsalis pedis. So musculoskeletal and neurologic system. So observe the spinal curvatures and check for scoliosis. Observe the client as the client walk in a heel to toe fashion. Hop on one leg, then the other leg. Perform finger to nose test. Perform Ramberg test. Stand.